Good day, everyone, and welcome back to the Circle Direct podcast, where we dive into the world of heart health. I'm Dr. Tiwa, and today we're tackling a very critical and life-saving topic. What are we talking about? Sudden cardiac arrest and arrhythmias. Identifying high-risk patients. So what is sudden cardiac arrest? So sudden cardiac arrest, or for this episode, we're going to call it SCA, is a silent threat. It can happen without warning and often with devastating consequences. But the good news is we can identify high-risk patients before the tragedy strikes. In this episode, what we're going to do is we're going to explore what causes sudden cardiac arrest, its connection with arrhythmias, and the key risk factors that you need to know about. Let's get started, and welcome to Circle Direct Podcast. Now, first of all, we have to understand sudden cardiac arrest as opposed to heart attack. Let's clear that common misconception. Sudden cardiac arrest is not the same as heart attack. While both are serious heart conditions, they are fundamentally different. Heart attack, which is myocardial infarction, happens when blood flow to the heart is blocked, usually due to formation of a clot or buildup of plaque in the arteries. While sudden cardiac arrest occurs when the heart's electrical system malfunctions, causing an irregular heartbeat or arrhythmia that stops the heart from pumping blood effectively. This can lead to a loss of consciousness. If left untreated, also can lead to death within minutes. SCA is often triggered by life-threatening arrhythmias such as ventricular fibrillation or ventricular tachycardia. Understanding these electrical disturbances is key to recognizing who is at risk. So, who is at risk? In identifying these high-risk patients, we have to understand that not everyone is at equal risk of SCA, that's sudden cardiac arrest. Certain conditions significantly increase the likelihood of experiencing a fatal arrhythmia. Here are the top factors. First of all, a previous cardiac arrest or previous arrhythmias, that is, a history of SCA or serious arrhythmias like sustained ventricular tachycardia or ventricular fibrillation, puts a person at high risk. Secondly, coronary artery disease. Most cases of SCAs occur in individuals with underlying coronary artery disease, even if they had not even had a prior heart attack. Number 3, heart failure and reduced ejection fraction. A weakened heart muscle within an ejection fraction below 35% is a major red flag. Fourthly, genetic heart disorders. If you as a person have conditions like a long QT syndrome, Brugada syndrome, and hypertrophic cardiomyopathy, it can lead to fatal arrhythmias. 5, a family history of sudden cardiac death. If a close relative suffered SCA, the genetic link may increase personal risk. 6, electrolyte imbalances. Abnormal potassium, abnormal magnesium, or calcium levels can trigger dangerous arrhythmias. Number 7, substance abuse. Cocaines, methamphetamines, and even excessive alcohol can induce arrhythmias that can then lead to SCAs. Number 8, severe sleep apnea. Untreated obstructive sleep apnea has been linked to dangerous heart rhythms. Number 9, athletes and young individuals with hidden heart conditions. While rare undiagnosed heart disease can cause SCA in otherwise healthy individuals, especially under stress, there are various examples that you can look through to get to. Now, what are the warning signs that you need to look out for so that you can early detect any risk for SCA? So unlike heart attack, which often comes with chest pain or even shortness of breath, sudden cardiac arrest rarely gives any warning signs. However, some people do experience symptoms in the hours or days before an event. You can see things like episodes of unexplained fainting. You can see palpitations or racing heartbeats. You can see things like chest pain or discomfort, especially when you exert yourself. You can see things like shortness of breath or unexplained fatigue. Now, if you or someone you know has these symptoms, especially with known risk factors, seek medical attention immediately. Now, moving on, how do we prevent sudden cardiac arrest? Prevention is key. So how do we reduce the risk of SCAs? First of all, you need to undergo routine heart screenings, especially for those that have a family history or underlying heart disease. Routine heart screenings are very important. Number 2, implantable cardioverter defibrillators, ICDs. For high-risk patients, an ICD can detect and correct life-threatening arrhythmias. Medications and lifestyle changes is also a factor for prevention. Beta blockers, ACE inhibitors, and lifestyle modifications can reduce cardiac stress. CPR training and AED awareness, knowing how to respond to SCA with CPR and using of an automated external defibrillator can save lives. Another factor for prevention is to avoid triggers, manage your stress effectively, stay hydrated, and avoid stimulants. That can help you prevent arrhythmic events. Sudden cardiac arrest is a silent killer, but it does not have to be. By identifying high-risk individuals, recognizing warning signs, and taking preventive steps, we can save lives. If you or a loved one have any risk factors that have been mentioned in this episode, please do talk to a healthcare provider about screening your heart and prevention that you can undergo to make sure that you're not a victim of SCAs. Thank you very much for joining us on this vital discussion. If you found this episode helpful, share it with your friends and family because it could save a life. Now, don't forget to subscribe to Seco Direct for more insightful heart health episodes. Until next time, take care and stay heart smart.